Hello, I'm Tana Turner, and this is my week 4 skinny cat. Cigarette smoking is considered the leading preventable contributor to disease and early death in the United States, and is a primary risk factor for heart disease according to the American Heart Association. Cigarettes are responsible for 442,000 deaths each year. This presentation will explore the impact of smoking and the benefits of quitting in the workplace. The major health risks associated with cigarette smoking are: smoking is responsible for about 90% of all lung cancer deaths in men and women. About 80% of chronic obstructive pulmonary disease, COPD, is caused by smoking, and smokers are 12 to 13 times more likely to die from COPD than non-smokers. Smoking increases coronary heart disease by 2 to 4 times, lung cancer by 25 times for men, and 25.7 times for women. Cigarette smoking harms nearly every organ of the body, causes many diseases, and reduces the health of smokers in general. Smoking can cause cancer almost anywhere in the body, from the bladder, esophagus, larynx, trachea, and lung to the mouth, brain, liver, and kidney. Smoking results in reduced overall health, causes increased absenteeism from work, and increased health care costs. The health benefits of smoking cessation. The good news is that quitting smoking results in benefits begin immediately and continue to improve over time. Some of the effects of smoking are reversible. Some benefits of quitting are: quitting smoking reduces cardiovascular risk sharply in 1 year. After quitting smoking in 2 to 5 years, the risk of stroke is about the same as a non-smoker. Risk for cancer of the mouth, throat, esophagus, and bladder drop by half within 5 years of quitting smoking. Your risk for lung cancer drops by half over 10 years after quitting smoking. The impact of a smoke-free environment. A smoke-free environment has the following results: clean air, less cigarette-related garbage, but fewer wildfires, less property damage, and a healthier environment. A work environment that is smoke-free is a safer, healthier place to work. Smoke-sensitive workers will not be bothered. Direct healthcare costs per company may be reduced. Work absenteeism is reduced because of fewer tobacco-related illnesses. When tobacco smoke matches and cigarette butts are taken out of the work facilities, maintenance costs go down. Furniture and equipment last longer. Higher risk of lower. How can behavioral change theories be used to elevate a person's readiness to quit smoking? The stages of change model, also called transferable model, helps physicians and change agents identify the stage of change the person is in and engages individuals in the process to move to the next stage. There are 6 stages of change according to the model: pre-contemplation, contemplation, preparation, action, and maintenance. And termination. Persons in the first stage, pre-contemplation, are not ready and termination. Persons in the first stage, pre-contemplation, are not ready to begin a program. The last 4 stages will lead to a lasting change when successful. Smokers need encouragement and support to be able to kick the habit and give up smoking forever. The stage of change approach gives doctors a tool for treatment and for tracking progress in their patients. Role modeling positive lifestyle habits. I believe that positive role modeling of lifestyle habits means eating a healthy diet and living an active lifestyle while maintaining an average weight. Being a positive role model means being a physical active and fit to others to see and emulate. Physical activity should be valued and practiced as contribution to health well-being, and enjoyment for life. The recommended 150 minutes of exercise each week is a starting point, and I would exceed that amount each week. A positive role model eats a balanced diet, maintaining weight that is appropriate for their age and height. A positive role model also avoids the use of drugs and unhealthy habits. One way to motivate change at each stage of the stages of change model is pre-contemplation stage. Individuals in this stage do not see the problem as a solution. They are not ready to take action. As a friend, I would point out the obvious to start the conversation. Contemplation stage. Individuals acknowledge that they have a problem and begin to think about it, solving it. I would join in the discussion of how to solve the problem and offer suggestions and support. Preparation stage. In this stage, individuals are planning to take action and make final adjustments before they begin to change their behavior. I would offer my support and assistance by helping to develop a plan of action. For action stage. In this stage, the individual is making the move for which they have been preparing. This stage requires commitment of time and energy. I would provide encouragement and support to help the individual reach their goal and be present for assistance. I would also help my friend avoid situations that may be difficult to handle. 5. Maintenance stage. Action is not the end of the change process. Without a strong commitment, there could be a relapse. So this stage is extremely important. I will continue to support and encourage the commitment that has been demonstrated. In the event that a relapse occurs, I would offer an encouraging word to support the individual to continue to restart the process. 6. Termination stage. This is the ultimate goal for a lifestyle change. The problem behavior is no longer an issue. I will support this stage by being a supportive friend. Describe 2 smoking cessation aids. 2 smoking cessation aids that I recommend are nicotine-containing gum, which contains 2 to 4 milligrams of nicotine per piece of gum. When used under a physician's guidance, the success rate is 40%. Use of the gum requires the user to immediately stop smoking. Initial cost of $50. Refills cost $30. 2. Chewing gum and package. This method of smoking cessation relieves nicotine withdrawal craving. The patches are stuck to the skin and gradually reduce the amount of nicotine delivered until the person is weaned off nicotine completely. When used with prescription medication, the success rate is 40%. The cost is comparable to that of the gum. Both products can cause irritation and should be prescribed by a doctor. Smoking remains a deadly and dangerous habit. Although the numbers of adult smokers have declined in the United States, smoking continues to be a serious epidemic throughout the world, resulting in millions of preventable deaths and diseases globally. Here are the references.